a consequence of reopening and loosening things up.
Despite the rise in COVID-19 cases in Jackson County, public health officials say we're not seeing a jump, but a steady rise.
Every week or every month that goes by, we're seeing significantly more cases than we were previously. And I think, that's happening all over the state.
One opinion is that the increase in cases is due to more asymptomatic people being tested. But health officer Dr. Jim Shame says that doesn't mean people aren't getting sick and spreading it.
We don't want to have our head in the ground and not know what we're dealing with. So I think it's always a good thing to have testing that tells you the extent of the disease.
Dr. Shame says there aren't many diseases that look like COVID-19 right now, including the flu. And the more we figure out who's positive, the more we can protect the most vulnerable.
The more testing you do, the more you're going to pick up asymptomatic or mildly symptomatic individuals. And, good for them. They're going to do fine. But, their grandma might not.
Public health says it's doing 2 or 3 times as much testing than a couple months ago, but our positivity rate is double, if not more, than back then.
The other thing to look at is hospitalizations. We have more people in the hospital than we did last week, at least. More people in the hospital than we'd ever had.
Dr. Shame says the incident rate is what's worrisome when it comes to spread. Up until last week, Jackson County was at 24.4 cases per 100,000 people. Now the county is at 42.5 cases per 100,000.
A little unclear whether it's going to continue or whether we're going to be able to flatten this particular curve again.